they needed. Or creating a black lung clinic would be a different idea. So that's who started. He had the idea, and he wrote a proposal to the Macy Foundation, and they thought it was good. And that's where we got the money to be paid. And each year when we finished in the summer, we had to write a report that said, okay, this is what I did, this is where I lived, this is where I worked. And I remember writing up that we found some children down in Robbins had scoliosis, or we saw a lot of dental caries. We described the conditions that we dealt with and what we saw in exchange for our small amount of pay.
You mentioned Bill. What stories do you remember?
I worked with him at the clinic up in Norma. Pediatrician, wasn't he?
Yes.
Yeah.
Came in once a week or.
Yeah, he wasn't there all the time. Yeah,
Maybe once
it
a
might have been
month,
once a week, but yeah, I just remember the name. And and I worked with him up there. But one of the things I always thought of with him was his handwriting. You tried to read his handwriting.
Kind of tiny,
Real tiny.
small.
Yeah, he was real neat, but it was real tiny. Yeah,
Mm-hmm.
I couldn't hardly read it.
So what role were you in when you were working with Bill?
We didn't have a nurse then, so I was clinic aide, I guess what they call it. I worked the patients up, did blood pressure, temperatures, throat cultures, or anything that the patient needed before they went in the room for the provider.
Great, great. Then you pointed out that you had one of the first paychecks. What role were you in the
I
first?
started out as a clinic aide, and with the picture I gave you, the blonde, she was the receptionist. She was hired at the same time as me. That's Debbie.
Oh, right. On the right.
Debbie Bird.
Debbie Bird, okay, great.
Yeah. And when she quit, and I don't remember what year she quit, she got another job. I moved into her position at the front desk, and I started doing.
And that's you?
Yeah.
That's great.
You didn't realize that.
I did.
Everybody says I've not changed much. But yeah, I went from clinic aide to receptionist basically, and did, what little bookkeeping there was to do, and taking what little money came in, and insurance billing, and that kind of thing, making appointments, paperwork.
There was no computers. You put everything on a logbook.
Yeah.
Kept up with it that way.
Answer the phones.
So what other roles have you played at Mountain Peoples? What other jobs have you liked?
You was receptionist when you left.
When I quit.
Yeah. But that was probably when Debbie Bird left and Janet moved up to receptionist. That's probably when I stepped in as the clinic aide. I did the workup on the patients. I did blood pressures, temperatures. I also did lab. We did a Lauver lab there. We did throat cultures, GC cultures. We did also, if we got growth on one of the cultures, we did what they call the sensitivity. You probably know what that is. On that big old disc. That told them what medicine they could treat it with that would get it. We did them. We did blood sugars, hematocrits. I also kept the instruments sterilized. We had an autoclave there that we did them on. Seemed like there was another piece of lab equipment that we had up there. Can't remember what it was. White blood cell.
A centrifuge for the.
Yeah, we had a centrifuge that we used that for the hematocrits. We put blood in them little tiny tubes.
Yeah, I remember that.
I stuck a lot of fingers and little toes. And the
Hurt
newborns,
me as bad as it did them.
the newborns, they'd bring them back and we'd do what they call a PKU test.
Yes.
We had to soak in 3 little circles on that card with their blood, and them little babies would just cry.
That's hard to do, isn't it?
Yeah, and sometimes you have to stick them more than once because it actually took quite a bit of blood.
Mm-hmm.
And then we'd send them off to the state. And they'd read them, whatever they do on them.
Mm-hmm. Try to make sure the babies don't have PKU disease.
Yeah.
Most of them don't.
They did that on every newborn.
Mm-hmm. Mm-hmm.
I don't know if they still do. I guess they
No,
do.
we do.
Mm-hmm.
We do it because you need to find it early, and if you know about it, you can do something about it.
Yeah. But then if
I'm sure the test is much more advanced than what
probably gonna put it on that little cardboard.
Yeah.
Screening tests.
That's the way we did it then.
Mhm.
But
I remember.
yeah, they did TB skin test, time test, EKGs. If a woman came in for a pap smear or anything like that, I set the room up with all the instruments and everything that they needed. And,
Mm-hmm.
and if it was a doctor, a male, I had to stay in the room with them. But
Yes,
if
we
it
were
was Sally or
chaperones.
somebody like that,
Mhm.
yeah,
Mhm.
it wasn't necessary.
Mhm. We did that in the health fair too.
But
So the female nurses
I drew
would be
blood
chaperones.
for lab, filled forms out, a little bit of everything.
So you've moved on to other roles now.
Yeah, I left there and I came to billing. I kind of got tired of it. I guess I've had enough
Mhm.
after all those years, so
That makes sense.
I had the opportunity to come to billing and I grabbed it.
So
It's
how long have you
totally
been?
new, but the one thing that I had the most trouble getting used to was the pace at the clinic. Every little move you made had to count to get everything done,
Mhm.
and it was much slower here,
Mm-hmm.
So it took me a while to get used to that. But
That you didn't have to just keep going.
no, but you did at the clinic. If the
Mhm.
phone wasn't ringing, there was somebody at the window,
Mm-hmm.
and then they got. Did we have that first computers up there before you left? I remember that old amber screen that was on it.
I don't remember a computer.
Well, anyway, the internet up there was so slow. That was when we got the better computers. The internet up there was so slow and we had paper charts.
Mm-hmm.
Yeah, everything was paper charts. So if a patient came in, I would have to. We had these little index cards that we put the patient's information on and had a little Rolodex. We put them in. That's how we found the patient. A birth date and had all that on it. But anyway, we'd get the patient's name or whatever and type it in the computer. And it was so slow. You know what painting the screen is? That's what it did. And I'd go and I'd file 3 or 4 charts while everything was coming up where I could print out and counter for them.
Oh
That's
my
how slow
goodness.
it was up there. Of course, it's a lot better now.
Absolutely.
Was
Do you have a computer in your office now?
Oh yeah,
And you use it all day?
oh yeah,
And it's a little faster?
oh yeah. It zips right along now. And our charts is all stored on that. We don't have those paper charts. That's what James was talking about in storage.
Mm-hmm.
All those old paper charts.
Mm-hmm.
But I don't know if we could even find one on anybody now.
He said they're down in that old clinic in Eldred Robbins, but I don't know how you put your hands on it.
Well, Norma Clinic had a water pipe up there several years ago. It flooded it.
Oh my goodness.
And they had a lot of the charts stored in the basement, and I don't know if they salvaged any of them or not. James would probably know.
Mm-hmm.
But
Mm-hmm.
they had to have this company come in and clean it up, and they put fans or heaters or something in there trying to dry it up. It was that bad.
I can imagine. Are there other roles you've played here that stand out in your mind?
Well, no, just the billing, which is what I do now. I've done this for the last probably 15 years.
And is that full-time work?
Yeah, keeps you busy.
Good for you, yeah.
Yeah.
I don't know how much you remember, but the first time we met, Bill had asked me to work with 2 people to be community health workers or possibly outreach workers so that you would know how to take a temperature, take a blood pressure. and perhaps drive a van to help people get into the clinic who might need to be seen but didn't have a car.
Yeah.
Do you have any recollections about that time?
Some, I can remember, I don't know where we've been unless we've been to a meeting or something. And there was somebody else with us. Would that have been the one from Stony Fork?
Yes. Mm-hmm.
I think she was a Darty, was she not?
That's what you said.
I'm not sure of the name. It seemed like it was Karen. Do you remember? That was after you left.
No, I was there, but I don't remember her.
Well, it was after you were gone.
As I recall, we took turns meeting, sometimes at Norma, sometimes at Stony Fork,
Yeah,
because one of you was one place and one was the other.
yeah. And then what, was it once a week or something?
Mm-hmm.
Something like that.
Mm-hmm.
I remember some, but I wasn't really in that position all that long until I moved up to Clinic K. Was a year or so.
I wonder if some of what we did as community outreach work prepared you to be the clinic aide. For example, you would have learned to take a blood pressure.
Yeah, I would have learned that.
Mm-hmm.
Of course, temperature.
We did pulses too,
Yeah,
as I recall.
pulse,
Mm-hmm.
respiration.
Mm-hmm.
You know.
I remember feeling excited that Bill asked me to do it and stay on and work here because I loved working here, but also a little nervous because I'd had my nursing training, but I hadn't worked very much, And then he asked me to train you as a clinic aide, a health educator, and a transporter. So if you were driving people around and they had health problems, you might answer their questions.